going to be manual muscle testing the anterior scalene for this video. So I'm just going to show my partner the actions of the anterior scalene, and we're going to be focusing on the prime motion of this muscle, which is lateral flexion. However, to help separate it from the other scalenes, we're going to include the additional neck actions. So the anterior scalene primarily does lateral flexion of the C-spine. However, its secondary actions are flexion and contralateral rotation of the neck. So for this beginning of this test, I'm going to ask my partner to slightly lift their head up off the table, engaging flexion, slightly rotate away from the side, contralateral rotation, and then try to bring his neck as far as he can over without the additional head tilt at the end. So it's not fully ear to shoulder, but they're just bringing as much lateral flexion of the neck as they can. Okay, so let's try that one more time without my guiding hands this time. Head off the table and all the way over the side. Excellent. Now, because the scalenes are the primary lateral flexor though, our MMT is just going to be pressured against the lateral flexion. I'm going to have him in flexion. I'm going to have him in that slight contralateral rotation with his head over. And then I'm going to try to place my hand underneath his ear as close to the base of the neck as I can without squishing the muscle. My opposite hand is going to go on his shoulder to make sure he doesn't move his entire body, and I'm going to try to bring his head back to neutral. 5, 4, 3, 2, and 1. Excellent. I'm going to keep my hand here below the ear, resting on the temporal bone near the mastoid, and he's going to lift his head slightly up, which is against gravity, look away, and then bring his neck as far as he can over towards that side. Good. So there's our concentric. Finally, we're going to lengthen the anterior scalene. Because of the flexion component, again, we need to drop the neck slightly into extension. So for this video, I'm going to ask him to again slide back towards me so that his shoulders are right on the edge of the table. You're going to be holding the neck and the head. Again, try to hold near the base of the head. So we're not going to be laterally flexing the head, but we're going to focus on laterally flexing the neck. So for the length position, we're going to drop him slightly into cervical extension. I'm going to rotate him towards the side, ipsilaterally, and then I'm going to laterally flex his neck over as far as I can. And there's our length position for the anterior scalene. Okay, I'm going to have you slide back down the table. All right, that is going to conclude our length and manual muscle test for the scalene.